We will begin our presentation by listing off some of the many birth control misconceptions people have. We will use evidence from the sources we have gathered to show where these misconceptions came from. We can use the interview with Nurse Gardner, the survey that we did, the student interviews, and the articles and videos that we have gathered. These will show that these misconceptions came from a source and that we aren't just making them up. And then we will transition by using interviews from UK students. These interviews will be short clips, so they will be engaging. They will answer questions such as, what do you know about birth control? What do you think do you think students are well educated on birth control? What misconceptions do students seem to have? And if they think students should be better educated on contraceptives, and if they know about the birth control options available through the UK Student Clinic. These interviews will show firsthand what UK students think about the topics, and they will clear up some of the warrants that we had. I know one of our warrants was that students actually care about birth control and its availability. Another warrant was that students are not educated on birth control. So these interviews would clear up those warrants. These interviews will also help us transition into the rest of the video, which will clear up those misconceptions, answer any of the questions the students had, and educate students on birth control and its availability through the University of Kentucky.
Hello, Hannah. I'm interviewing you on birth control and its cost in Lexington and its availability to UK students and the birth control oral pill. Our first question is, do you think if the university makes birth control easier and cheaper to get, more girls on campus would use it? And if so, why?
Birth control for most people on health insurance is free, but for those students who don't have health insurance, it'd probably make it a lot easier if the university supplied it at like a lower rate for college students.
For my second question, how does the birth control pill work, Hannah?
The birth control pill regulates your hormones, so it puts you on like a monthly schedule for your period, and it also provides hormones that like don't allow you to get pregnant, but it doesn't work like, it's like 99% chance that it works.
For my third question, why do you think the pill form of birth control is the best way to go for birth control?
The pill puts you on a daily schedule, so you take it around the same minute every day, and it just adds to everything you do in your routine. Yeah, that's all I was going to say.
For my fourth question, do you think condoms are safer than birth control?
I think that condoms are like relying on the other person, so if you take your birth control every day, that's something that you're in charge of, and you don't really have to know like what the other person's preparations are for. Like, you know that you're prepared when it comes to having protected and safe sex.
Birth control oral pills are pills that you take monthly, and then you take them daily at the same time of day. Some of the health benefits and advantages are regular periods, light flow, less menstrual cramping, reduced risk of non-cancerous lumps or cysts in the breast, reduced risk of cancer of the ovary and cancer of the lining of the uterus. Some of the side effects you can get from taking the oral birth control pill is nausea, spotting or light bleeding between periods, weight gain, and breast tenderness. Some of the risk and disadvantages are heart attack, blood pressure, migraines and stroke, and blood clots.
Hello, I'm interviewing Nick Norman on birth control and its cost and availability to UK students. Our first question is, why should the university make birth control easy to get?
I believe that the university should make birth control simpler to procure, strictly because I do believe that teenage and late teenage pregnancies are affecting a lot in the college aspect of life. If you, for instance, if an individual becomes pregnant as a freshman or sophomore in college, the distractions obviously from being pregnant, the 9-month process, and all the way up to having the child can really kind of restrict and hinder the performance in the individual academically, socially, and aspects, honestly, just all the way across the board. So I do believe that we need to lower the cost for that reason.
If the price of birth control was decreased, what do you believe would happen, Nick?
I definitely believe that the frequency of which birth control is used would increase. I do think it is unfair how, if you simply cannot afford birth control, you cannot reap the benefits strictly from birth control. So essentially, yes, just the frequency increasing, and then the effects that would have on the population that's using it. So.
Thank you, Nick. Thank you, Nick, for your.
That's all I got. I'm sorry. That's all I got.
Thank you, Nick, for your interview.
Another form of birth control researched in our public service announcement is the IUD, or the intrauterine device. In this portion of my research, I found an article from the Time magazine titled, "More Women Are Getting the IUD, an Implant for Birth Control." This article, written by Alexandria Sifferlin, focuses on the transformation in the birth control industry. This long-lasting reversible contraceptive has been reported to be one of the most favorable forms of birth controls amongst women. A report from the Guttmacher Institute, a nonprofit organization, shows data that 9% of women used the IUD in 2009, and that number increased to 12% in 2012. One can assume that this number will only continue to increase due to the simplicity of this form of birth control. The report from this nonprofit organization also found that the spike in the usage of IUD was most common amongst Hispanic women, women with private health insurance, women who have never had kids, and women with fewer than 2 sexual partners in the last year. Another reason stated in the article why this contraceptive is popular is because the failure rate is less than 1%, meaning that this is the most effective out of all other forms of birth control. In addition, we researched for the PSA the NuvaRing. During past research, I came to find this is a form of birth control similar to the oral pills. In this portion of my research, I dug deeper and found the horrible danger of the NuvaRing. In the Vanity Fair article titled "Danger in the Ring," 24-year-old Erica Langhart was described as a talented, beautiful woman bound for law school. The Monday before Thanksgiving, when Erica's boyfriend arrived home from work, he came to find Erica on the floor struggling for air. When the ambulance arrived, she encountered 2 heart attacks in the vehicle and was semi-conscious when she arrived to the hospital. She died on Thanksgiving Day. Erica suffered from a pulmonary embolism that was caused from the NuvaRing. Erica's mom found that there are many cases of blood clots that form because of this contraceptive, and there has been more than 1,000 lawsuits against the manufacturer. Although there may be misconceptions for many forms of birth control, the NuvaRing is one that after my research I am still very skeptical about.
The birth control patch is given to women to prevent pregnancy. The patch works by sticking to the skin and releasing 2 different hormones into the body. These 2 hormones are estrogen and progesterone. The patch is considered to be very effective when used correctly. A new patch is placed on the buttocks, upper arm, stomach, or back once a week. This is repeated for 3 weeks, followed by a 4th week, when no patch will be placed anywhere on the body. Many women like to use the patch when they are forgetful and are not good at remembering to take a daily pill. The patch is much more convenient because one would only have to remember to switch out the patch once a week for 3 weeks. Emergency contraception is a type of birth control that prevents pregnancy after unprotected sex. This pill can be up to 89% effective, but only when taken on time. This pill should be taken no later than 72 hours after unprotected sex, but the effectiveness increases the sooner the pill is taken after intercourse. These pills are available at any local Walgreens as well as the University of Kentucky clinic for a discounted price. One misconception regarding the emergency contraception pills is the fact that people think the pill will affect or destroy an existing pregnancy, when in fact it does not harm an already fertilized egg. In an article on a debate over Plan B from CBS News, Dr. Susan Wood states, "It is more effective the quicker you have it. This is why it needs to be over the counter." This may be only for emergencies, but many people believe that emergency contraception is very helpful in decreasing the rate of unwanted pregnancy.
The next form of birth control we will be talking about is the implant, also known as Nexplanon. The implant is inserted into the forearm. The implant lasts for up to 3 years, and then after 3 years, with a simple procedure, they go in and they cut it out of your forearm, and then they insert the new one if you want it. Since there is a 3-year period that the implant is keeping the user from pregnancy, it is beneficial for people with busy schedules or people, like college students, looking for a reliable birth control. According to the article, Contraceptive Implants Providing Better Choice to Meet Growing Family Planning Demand by Roy Jacobson and Harriet Stanley, the contraceptive implants are extremely effective, long-acting, and suitable for nearly all women. The article also states that the implant is 120 times more effective than the injectable. According to the article, A Tale of Two Birth Control Implants by Connor Davies, the author states, "The implant would allow me to finish college without having to think about my birth control at all. Insert it and forget it." These two articles provide evidence that the implant, Nexplanon, is a very effective form of birth control for a college student. The next form of birth control we will be talking about is the injection, also known as Depo-Provera. The injection is a 3-month lasting form of birth control. Benefits of the injection, stated by the American College of Obstetricians and Gynecologists, states that the shot may reduce pelvic pain caused by endometriosis and possible absence of periods. In another article, Quiet Reversal, Why Teenage Girls Love the Shot, Why Others Aren't So Sure, birth control method helps lower pregnancy rates. No one needs to know. Clinic frets over the cost. It states that the injection is a major presence among teens in America's inner cities and other poor communities. This statement implies that the shot is a very affordable form of birth control.
To conclude our presentation, we will sum up the birth control availability at the UK clinic. We can include a slide on this with the address, phone number, and the hours of the UK clinic. We can also talk about the birth control education opportunities. We can talk about the health education classes that are taught by Nurse Gardner and other health education classes taught through UK.